Radiation oncology is a field where we use different forms of radiation to cure usually malignant cancer cells or malignant tumors. I actually came out of training in 1996. So that's what 20 some years. In that 20-year period, we went from using what we call three-dimensional planning, where we would give radiation to a bigger volume. You would have more normal tissue treated and more toxicity, now to this new type of radiation called intensity modulated radiation therapy, where we can actually target the tumor and other areas that might be at risk for having cancer cells and spare the normal tissue. And I can give you an example. Let's say we're treating a person with rectal cancer. Prior to this new technology for IMRT, we would treat a large field in the pelvis. And what you would end up including in that would be the bladder, not just the rectum, the bone marrow, the small bowel. And then patients would then, unfortunately, we have a lot of GI, gastrointestinal toxicity, and a lot of GU, or urinary toxicity. By using the IMRT technique, I can actually spare the bladder, spare the small bowel, and spare the bone marrow. And that significantly reduces the toxicity to the patient. A lot of times patients come in and they're very anxious. They don't know what to expect. They've heard all these horrible stories, because everybody will tell you, I've had a person, a friend who got treated with radiation, they got burned, and, they had the worst side effects. And so they come in and they're just like really shaking in the chair. And then the whole goal is for us to educate them, number one, about their disease, number two, how we can treat it, and number three, how things are so different, as I said before, which was 20 years ago, versus what it is today, and how we can really minimize those side effects. And I think that once patients realize that, and they go through the treatment, they're so surprised. They're like, they're nothing what I thought it was going to be, and that's part. It's a big part to not only just educate them, because you want them to make sure that they understand why they need to be treated, but also how we can try to minimize the side effects from the therapy. How can you do this without having compassion for your patients who are coming in, who are, getting treated every day? I mean, that's one of the most important parts. And I think that's the part that, as I said before, it's nice to be able to see a patient, treat a patient, and then 5 years down the road, they come back to see you, and, you're like their friend. You went through, a difficult time with them, and then they're doing well. And it's always a great pleasure to discharge them off your service. You said they're so happy, they're running out the building, because they're so happy to be discharged off. They know they've done well. So that compassion part is very important.